Hi everyone, my name is Madison and I'm going to be talking about my fall 2020 Kirka poster. Um, I worked on this over the summer too, so this is also my SURF project, and I worked with Professor Hilary Sackett-Taylor from the Economics and Management Department. Um, so this table right here talks about the descriptions of the big five personality traits. And the characteristics that are listed are if you have a high score in that specific trait, those would be the characteristics that you show. So, for example, if you're conscientious and you have a high score in that trait, you would be responsible, careful, thorough, and organized. We also included the different parts of our project. So, one big part of our project was the survey, which included questions on demographics, health history, health behaviors, influencing factors, the Big Five personality trait, and a choice experiment. We used a random utility model, um, which deals with the alternative utility that people can experience based on different outcomes. And then one of the big parts of our project was a multivariate linear regression. And the table that is shown right here talks about or shows different coefficient estimates for these regressions and how they impact different dependent variables, which are listed right here. So physical activity, healthy diet, doctor visits, etc. And the coefficients listed are for each of the big five personality traits. So for example, extroversion had a positive impact on physical activity, mental health, emergency care, and dental care. Agreeable had a negative impact on physical activity, a positive impact on doctor's visits, and negative impacts on mental health and emergency care. And to interpret this table, you look at the coefficient estimates, and then so it measures an impact of a 1 unit increase in a personality trait, and that shows the impact that it would have on physical activity or any of the other dependent variables. So for example, if extroversion were to increase by 1 unit, it would impact physical activity by a scale of 0.060. And then another part we did was a conditional logit model, which deals with alternative specific variables, which were our price and value attributes of our insurance plans, which consisted of premiums, deductibles, um, access to emergency care, child specialty care, and a healthy lifestyle discount. So the table with these results um, show how different independent variables impacted the dependent variables we ran this specific regression on. So for example, demographic variables such as age had a negative impact when individuals were choosing health insurance plans, while health status had a positive impact. And personality variables such as extroversion had a positive impact, while neuroticism had a negative impact, and the health plan attributes such as premium had a negative impact. So to interpret this, we would say that age, so older people were less likely to choose the plans we provided to them relative to having a no option. So they were more likely to choose a no option plan rather than a plan that we provided to them. Similar to health status, people who perceived themselves to be healthier were more likely to choose either plan A or plan B relative to no plan at all. We then discussed some of our implications and results that we got from our project right here, and then we included a link to a reference page on a Google Doc right here. Thank you.